In this series, we will be discussing specific examples of design techniques that makes a positive difference for people living with certain human conditions.
The more a designer understands the client and or the community, the more effective and respectful the design will be.
Welcome to Inclusive Designers Podcast. I'm your host, Janet Roach.
And I'm your moderator, Carolyn Robbins.
Carolyn, we have such a wonderful show today, but first we are thrilled to announce that we are still in the top 20 on FeedSpot's list of best designed podcasts on the internet. Woo! And a big thank you to you, our listeners.
Yes, and it doesn't surprise me at all, but I might be a little bit biased. And I think this episode should definitely keep us on that list. And with that news aside, we welcome you to our first podcast of 2023.
Yes, moving right along, our guest today is Alex Tan, who is indeed creating a difference within the built environment and using a collaborative and evidence-based approach to design. The groundbreaking work he and his design innovation team at Philips are doing is changing how hospitals envision the future of both the NICU, which is the Neonatal Intensive Care Unit, and adolescent mental health care emergency rooms. The way they research and implement these next generation spaces using adaptive research and ambient technology is truly terrific for any designer for whatever environments they will be creating. We are thrilled to interview him and discuss his process.
But first, let me tell you a little more about Alex Tan, who is the Design Innovation Director at Philips. According to his own bio, Alex is a visionary thinker and leader with a diverse background that spans across many industries and design disciplines. His leadership style is very hands-on. He leads through example and inspiration. He and his multi-disciplinary design team collaborate with research scientists to invent and set the design vision and direction for the future of healthcare through a co-creation design process and prototyping. In his own words, "We are the tip of the spear that pushes the boundary of the possible. Our solutions combine hardware, software, environments, and services, and aim to solve key challenges in healthcare."
Alex will introduce us to the innovative tools they created and how these human-centered design solutions are making a difference in their pilot emergency room spaces today.
And we even learn about his side project, a design of his own invention, a plush toy that is brightening the lives of little ones everywhere.
That is a pun that will make more sense later. But we'll let Alex tell us about this, as well as some important insights that will be of benefit to all of us in the inclusive design field.
And with that, here is our interview with Alex Tan, designer, creator, and innovation director.
Well, hello and welcome to Alex Tan here on Inclusive Designers Podcast. Thank you so much for joining us today, Alex.
Yes, thank you for having me on board.
Thank you. So why don't we just jump right on in? And I know that there's a couple of projects that you're working on. I think what's kind of interesting is that there's so many different parts of dynamics about your process. And why don't you tell us a little bit about how you created these types of things with Philips?
Yeah, there's definitely several projects that we work on in Philips, and I think the two that will be worthwhile to talk about is, of course, the Lotus NICU of the future. So that's one. And the other one, we don't really have a name for it, but it's really how to reimagine behavioral health actually in the emergency department. So I think those are the two projects that it's worthwhile to talk about,
Right.
That we can, look into the process of how we do it and reveal a bit more.
One is within the NICU and one is within the emergency room in terms of behavior. Is there one that you want to showcase on the top of the hour?
Yeah, we can start with the NICU actually as one of the examples.
Yeah, why don't we start with the NICU? This is a pilot program, right, at this point?
This is it started off as pilot program, but it's actually being installed in hospital actually in Florida in one of the NICUs actually. So it is, we strive to bring everything into the market because that's, I think, where it makes the impact actually. Although, I work in the innovation department, we do a lot of research, front-end research. We strive to test it out and implement it in the market. So, to really have that impact.
Right. So why don't you explain to us a little bit about this particular product? Because I piece that you got in the NICU is really quite fascinating. You're looking at all the like different senses: touch, smell, taste, sound, and light. All the things that as inclusive designers, I encourage designers to really kind of look at. So why don't you talk a little bit about that and then the process and get our listeners into what these particular projects are?
Yeah, so yeah, definitely can talk about it. So the project I think started as one of these, of course, Philips, we have products in the NICU, we have different things like, monitors, we have, ventilators for the baby. And, all these are very, very much right now kind of very separate elements, right? They don't inform each other, they don't work together as a complete kind of system. So we kicked off this project, this is, I think, several years ago, I'd like to say 2018, where there's a project to really try and understand the space of the NICU and how can we create a kind of complete solution to address all the different needs, right? Because with all these individual products, you don't really connect them together to deliver more value for the users, in this case, the clinicians, the nurses, and ultimately the baby themselves. And in this project, actually, we're very lucky to have worked with some of these thought leaders within the NICU space. And we were introduced to this whole integrative developmental model, actually. So meaning that, the idea that you want to, when you look at the baby or treating the baby, you want to be as inclusive as possible in terms of looking at not just their physiological aspects, but also some of the psychological aspects. So, where sound comes in, where their sensory perception of pain, light, heat, all these, so temperature, touch, even, and there was this kind of model that was created that we kind of worked closely together with the clinicians to really look at how we can create solutions along this kind of this whole circle, actually. So this integrative developmental model that we were working on. And it's kind of interesting, I think, in the aspects of talking about inclusivity, is that that the parent was also very much part of that solution, right? So we had to include not just the baby and all these different needs of the baby, but the clinicians, the physicians, the neonatologists, the nurses, and the parents, and how much the parents actually played a part in the baby's care actually impacted the results. And there's lots of evidence, right? So
Right.
having skin to skin contact with the baby, talking to them, being present and being engaged in this whole process of in their stay in NICU really helped improve the outcome. So this is very well-known study, but there were not actually any products or solutions geared at the parents, actually. So what we tried to do is just kind of a holistic solution that looked at how could we create something for all the different stakeholders within this NICU space.
Right.
So we have some of the solutions are really looking at a dashboard, for instance, for the physicians to be able to track all the different aspects of the baby's development, right? So like I said, not just the heart rate and the breathing and these kinds of things, but also the temperature of the room, the sound levels, are they getting enough sleep? Are they in pain? So all these kinds of things. And also we provided a dashboard for the parents as well, so they can actually participate in the care of their baby and being able to be informed, hey, how's the baby doing? And be able to have almost like a calendar or agenda that they could collaborate with the clinicians to deliver care. So, hey, look, this is maybe a good time, for instance, for them to come in to do kind of this kangaroo care, so this skin to skin contact with the baby, and that really, helps their development. So we're looking at, very much a holistic solution and looking at how this room could really facilitate all these folks coming together, all the technologies coming together to work in concert as one.
Yeah, I think that that's like it's really key in the fact that I think it's fascinating. It took us until 2018, you said, to think like maybe we should be asking the parents, like who spend the majority of time there, how what they're thinking, what they're feeling, and how they're behaving within the built environment as well, right?
Yeah.
Now, are you saying that so it's basic explain it to people that maybe are in the car that are not able to look it up right now? What is this? What it's a touch screen, right?
Yeah. So yeah, if I could to describe what it is, I think it's several things actually. So it's firstly the whole room design and the lighting and everything together. So we actually designed the space itself to determine how the equipment's laid out, right?
Right.
So, because in a neonatal ICU, there's lots of equipment for the baby, there's a lot of clutter. So how can you design the optimal space for the clinicians to work in there, for the parents also to stay over, right, and provide care for their baby? So that's one of the first things is really the environment, spatial design. So looking at the positions of the light, looking at where the monitors needs to sit. So that's, I think, the first thing. The second thing is this, the dashboard actually. So this is a piece of software that would actually bring in all the different disparate electronic medical records, all the different monitors, all the equipment data that's being produced around the baby, and bring it together in one place. Because right now, all the doctors and clinicians need to go to different computers, different screens to search up this data and kind of combining in their head to form a picture or diagnosis of the baby. So we're actually bringing it together in a dashboard that makes it very apparent to get a quick overview of what's happening, right? The other part is that we also base the design of the organization of information around this integrative developmental care model, which looks at this 360 view of the baby, through all the body organ systems and the kind of softer care aspect. So that was also something very prominently displayed in our dashboard. So I think that's the other thing. And then the other part of the dashboard, like I said, is a piece of software, at least for the parents, to be able to then come in and be able to view, change that same dashboard, that big screen in the baby's room, to a different, let's say, rendering of the information. So it's more friendly for the parents, actually. So it's not, the clinical jargon, but it's being translated and helps them, track how their baby's doing. They helps them almost kind of suggest education or training videos for them to learn about the development of the baby. So these are the main key aspects, right? So the environment and this kind of what we call the collaborative dashboard.
Right.
So those were the two key elements. There were some other, let's say, elements that we designed as well. So looking at smaller things in terms of around the incubator, having a camera that would basically look at the baby and use that camera technology to sense the vital signs. So you don't have to put these patches on the baby's skin, which are very painful because when they're premature, their skin is like paper thin, and every kind of electrodes that you put on it and you take off, it really tears their skin. So we try to also create a better way of sensing the baby's vitals.
Well, that's interesting.
So this is basically part of that bigger research project.
Right.
Yeah. And I think also to your point earlier, about clinical care not involving parents or even just the family of patients, I think that's something that is still a challenge, right? I think a lot of science are now beginning to kind of see that the more the family members are involved in the care of the patient, the better the outcomes and the better the faster the healing is, right? And you already have I've kind of seen two schools of let's say practice. Some doctors are really much about, hey, we want to open up the patient's chart to the family so they can see everything, right? The family can know everything so they can be more informed and help with the care journey and the care decisions. And others are saying, no, we don't want the families to see that because they just ask more questions and there's just more work for us to do. So, there's definitely this kind of, two sides to it.
Right. It's a complete two sides of the coin, for sure. Well, I mean, again, I do think, just the word inclusive designers, that's what we try to do. And I think getting that family input was really beneficial for you guys. Like, do you remember, was there any particular thing that really stood out to you were you doing interviews with them or were you following them? What was your process?
So the team spent time in the NICU and we did a lot of shadowing, right? So going to the NICU, we got permission to kind of observe and just almost be like a fly on the wall to observe the staff at work. And where the family gave permissions, we're also in the room and we kind of spoke with the staff members and interviewed the families to just kind of get to understand what their thoughts were, right? And it's kind of also striking that this whole new way of looking at this family-centered care, this developmental care for the babies, is also not something that in medicine is being practiced, right? So it's unequal. We went to hospitals that were very much embracing this, and some hospitals that say, no, we want to keep everything away from the parents. So there was the two sides, right? So we kind of observed this.
Really?
Yeah.
Wow.
And that was kind of eye-opening. We were actually lucky and not so unlucky in that one of our team members actually, during the project, was, she actually had a premature birth.
Oh, really?
And she spent a long time in the NICU.
Wow.
So she was actually able to provide us a very good first-hand insights, right? And she also helped drive a lot of the, thought and thinking about, hey, look what our parents looking for, so that was very lucky for us for our project, but of course, not lucky for her.
Right.
Yeah.
I understand.
Yeah, I know.
Right. Yeah, it's a little hard to say lucky in that particular situation, but there is, I mean, it was advantageous.
It
I
was
guess maybe that's a
advantageous.
better word or something.
Yes, exactly.
So what was her takeaway? That she was like, you must have like, or this must be, or
Yeah. So the one big thing, and we kind of suspected it already, and she kind of emphasizes that just the sheer amount of information that she had to absorb, right? So she was at a hospital that did not really practice this family-centered care as much. And basically, at the start of her NICU stay, they just gave her a big binder, really, and just said, here, that's all the information there, read it. And there was, it's just like brochures, all kinds of information, not organized. So that was one of the things that was really overwhelming for her, right? Trying to just keep track of, what do I need to know? What's important?
right. I mean, her brain's spinning anyways, right? Her child is in the NICU. Like, will they survive? All that stuff. And
Yeah,
now try to absorb all of this information.
exactly. And actually, one thing I would like to say, her baby is now doing really well.
Oh,
Yeah, he's doing great.
that's good.
And one of the things I would say is that, yeah, it is overwhelming, right? As a parents, the last thing you kind of expect when you have a pregnancy is, hey, I'm going to bring the baby back in a nice nursery, and that's
Out the window.
yeah,
Right.
out the window, exactly. And you are then spending months in the NICU. So that was one of the key things, right? And I think the other thing was just trying to balance work and work life with the having to visit the NICU, because as parents you want to be there to spend as much time as possible with a baby, and every moment that was away was of course kind of frustrating, right?
Right.
So you have to balance that. And each time she came back, she's like, okay, what are some of the updates, right? What's happened to my baby? So she wanted to know all these things. And that was very difficult to also discover. So as one of the first things that we did in our dashboard was to be able to almost list out as a summary for the parents, hey, what happened while you're away, right?
What happened while they wait? Oh, that's great.
Yeah.
Yeah, right.
And
Yeah.
they also had a kind of a planning calendar to say, hey, look, what are the plans for the baby today? Are we going to do some kangaroo care? Are we going to give medications? Are we going to do certain procedures or go for a scan? So that was kind of very nicely laid out, which helped parents feel more comfortable. And we also of course incorporated this camera idea for parents to be able to remotely look into the NICU, and this is already existing, right? Some
Right.
hospitals have that, to see their baby and be able to just kind of connect with them, see how everything's doing. But we extended it to include all the dashboard elements, so that on an app on their phone or a tablet, they could basically be able to track the progress of their baby. So this is really the ambition of what we are looking to do.
Right. Yeah. No, I mean, it's interesting that whole work balance, right? Because we don't really have really good family leave in the United States. So
Yeah.
I gotta think it would be awfully hard to leave, right?
Yeah.
Like to top it all up. But you know that everything is sort of planned out and thought out, and that you don't have to maybe go through a binder or something
Yeah.
to try to find it, I think is really kind of terrific. So those were a few of the takeaways that you had. So then you talked about the design implementation of what you did to help to correct that.
Yeah.
I wanted to say there was something else that you had mentioned at the top. It was that there was just kind of fascinated about what I was listening to. And then all of a sudden I was like, I wanted to come back and circle back on that question.
Was that about the spatial design?
The spatial design. Yes, it was about the spatial design. And I wanted to kind of expand on that. Maybe you could talk a little bit more about that and what were your discoveries and how your process came to be for those spatial designs.
Yeah, absolutely. I think one of the things we looked at, again, in NICU, throughout the country, different hospitals also have the very different philosophy. So, you have let's say, the open bay concept, right? So where you have lots of babies in little pods in this one big open room. And the new model of it is really moving towards a single family room, meaning that you have the baby in the room by themselves, that this room is enclosed. The advantages of that is that it reduces the disturbance, right, from other babies crying or other things. So you kind of create this more sound,
Calming.
calming environment.
Right.
So I think that's one of the key aspects that we saw, that there's a trend actually. So many of the new NICUs built in the US are all single family rooms. So with that, right, in the design of the room, we also wanted to accommodate all the different functions of the room, right? So in a sense that at certain times, because it's in a hospital, there needs to be medical procedures happening. So sometimes, babies do crash and they need to, and there's an emergency. They want very much the bright lights on and be able to, do a intervention, right? And other times when the mother is there, maybe with her baby, and as I said, performing kangaroo care. And this is sometimes they try to encourage, for many hours, whereby they sit in the chair with the baby, from 2, 3 hours to 5, 6, 7 hours, just lying there with their baby. So you want to create this calming, relaxing environment. So we wanted to be able to adjust the lights to that. And also during more just, daily rounding of the physicians to check up on the baby, you maybe want a different type of light, or they're doing charting and caring for the baby, such as changing the diapers, or changing out the sheets and things like this. You want different lights.
Right.
So we actually created this, the concept of this adaptive environment that would change and flex according to the different workflows, the different needs and desires for the people in there, to the aspect of, hey, look, when the baby is maybe vacating the room and the janitor or the cleaners need to come in, you want also really nice bright lights to be able to clean the room nicely, to be when the baby's sleeping, keep everything calm, the lights down,
right.
and also to have like kind of digital signage out there to say, hey, baby's sleeping, do not disturb.
That's actually cute, right? I mean, that makes so much sense, though, right?
So and as a company, and Philips coming in was to try and use some of these technologies to be able to give indication outside the room about the status of the room, because with the rooms and with closed doors, you don't know what's really happening in there, right? So you don't do barge in on the mother and the baby, or something's happening. So using those technologies to project the information outside was again one of the things that we try to look at holistically, how this room could perform as a as a well-oiled machine in a sense, right?
Right. And in a whole system, right? I mean, that's the other part of it. And we talk about it a lot. You're helping the baby with their circadian system too, right?
Yeah.
By changing out those lights. And
exactly.
And I saw that you've got some biophilia projected on some of the walls and stuff like that.
Mm-hmm.
So more ways to calm
That's
the central nervous system, right?
That's correct.
And then, like you said, and then to have that information being projected on the outside so that, there's no kind of disturbance and stuff like that. I'd be interested to hear from you. We talked a little bit about light. We talked a little bit about sound. I mean, I guess the touch part is that kangaroo,
Yes.
right? And you call it
kangaroo care.
kangaroo care.
Yeah.
Right. And having the baby with the parent. And can you talk a little bit more about your design aspects for that particular type of programming, I would call it, I guess?
Yeah. So I think let's maybe start along the touch parts, right? So in the room design, we try to ensure that it's kind of optimally set up for the for the baby, to bring the baby out of the incubator and to be able to then transfer that to the mother's chest. So facilitating that whole process, because it's actually not easy. So a lot of babies, they have these kind of cords and things connected to them, life support system, ventilators. So that makes it harder. So, unfortunately, we don't have a solution for a wireless ventilator that's still there. So we had, that's something that, we had to basically design the room and the space itself to make it easier to that transition from the incubator to the mother's lap, actually, or body, and to be able to track that time, because that timing also is reflected back in the dashboard. So at the end of the, week or the month, they can see, hey, how much kangaroo care has been given to this baby. And then, in the long term, we're trying to track that correlation, right? So again, giving data to that, right? The other things that we also place in the room actually is also sensors to measure the level of sound, the level of light, even volatile chemicals and compounds actually. So sensors for that.
I was going to say, how are you dealing with the sense of smell?
Yes, exactly.
So these are all sensors? These are all Philips sensors? Is that correct?
Yeah, this is what we call a kind of sensor bar that we place in the room. So we developed that using just off-the-shelf components, right? But the idea is that just to bring that together in a unique way. So to basically measure all these things. And that's again a study we're trying to do to just correlate, right, in the sense of, hey, the smell, if they're using these bleach and detergents, does that have an impact on the baby?
It hurts everybody.
So you can maybe also correlate with the heart rate, or things like this. So these kinds of things where you have all these data coming into one place, that's where we're trying to look at.
So you're doing long-term studies with this as well?
Yeah, we're hoping to do that actually. So there is things put in place to try and track those things.
Right, so we can prove to everybody that you were right.
Yeah.
You're right.
We will see.
I'm
Exactly.
going with you were right.
Yeah.
Yes. So let's see, we talked about touch, smell. What about taste? What are you doing with taste? What is that?
Yeah, so taste is something that's
Might just be something minor.
yeah, it's something minor. Yeah, I think so. Actually, what I learned is that the smell and taste sensory organs are very closely tied together,
Related.
related.
Right.
And yeah, I wish Leslie, one of our nurses, that was really, she gave a whole lecture about this. It was very fascinating. And that is basically also something that's tied to the smell.
Right.
So, we kind of combine them together. They don't eat anything at that stage. So, that's not taste.
Right.
The position of baby actually is also something very important that we're tracking. So using the camera as well to look at, because the idea that the baby, if they're placed in let's say, a position that's not, good for their development, they end up with really lifelong kind of issues, right?
Issues, right.
So the bone structure, like the hips, they might be, splayed open so they need to be constrained actually to provide the muscle tone, because in the womb they're kicking against the womb to kind of,
Get their muscles going.
basically push and exercise their muscles.
Right,
Yeah.
right.
So if the position is not right, so if they're laid, let's say on their back, their arms open for too long, then that will contribute to their development of their bone structure differently. The head shape is very, malleable.
Yeah, we know about the head, right?
Yeah.
If they've been lying too long on like a mattress on their
Yeah.
back, right? They get that flat head, right?
Yes, exactly.
Yeah.
So all these kinds of things. So those are again tracking the kind of positioning was something that we also track. Trying to work out our way around. Of course, the light we know, so not too much. The light, appropriate levels of lights.
Yeah.
And then yeah, looking at circadian rhythm later on in the recovery. So later on when they're old enough. Of course, parental participation was a very important one. The
Right.
parents actually also, we were tracking how much they are kind of at least keeping up on their education, because the idea is that you want to prepare the parents to be able to discharge the baby safely, right? So when they go home, they have to maybe do some of the changing of the tubes, or change the diaper, or do the washing, and there's certain instructions. So we provide that set of education material that then we could track. Hey, have the parents been watching it, and how far along that kind of discharge readiness they are actually. So those are some of the other things that we were tracking.
Well, but keeping in that same vein, so just kind of moving on to the next project, which was behavioral, right?
Yeah.
In the emergency room, I thought that this was kind of fascinating. It was also about, if I understood it correctly, it was mostly about juveniles, right? Or is it pediatric?
Yeah, it's a pediatric behavioral health.
Right.
And this project started actually also with just talking to one of the hospitals. Actually, that was one of our customers. They came to visit our innovation lab in Cambridge. And, they at that time were building a new facility or new emergency department. And behavioral, I guess, behavioral health, mental health was one of the big issues with many hospitals at that time, and this was pre-COVID already. There was they're seeing a ramping up of
Was a problem.
problems,
Yeah.
children coming to emergency departments as a last resort, because there hasn't been any, let's say, investment in a lot of these interventions for behavioral health, mental health. Lack of investment and lack of infrastructure outside to support these folks.
Yeah.
So what they end up is going to the emergency room and end up clogging up the emergency room. The emergency rooms are not ready to handle these kids, right? And some of them, what they call psychiatric boarding, will spend days, even I've heard weeks, in this single kind of room, usually without windows that have to be really secure, and they'll spend hours, days, weeks, depending on their severity, in locked up in these rooms actually. And at least the thinking is that, hey, we need to keep these children safe so they don't harm themselves or they don't harm others.
Right.
So they just basically strip everything from the room. It's basically a very bare, empty room actually.
Right. It's
Yeah.
like usually it's a bed, usually not even like a blanket or what have you.
Yeah,
No shoelaces, no belts, not. I
exactly.
mean, like everything has to go,
Yeah,
and no curtains.
exactly.
So I'm sorry, I didn't mean to interrupt you, but
No,
yes, it's also very. I mean, how triggering is that for young folks? Like
yeah,
then all of your stuff is taken away, and right,
yeah.
and
And I think it definitely exacerbates the problem, right?
right.
Being kind of coming into this where you lose control, right? You're already not feeling well.
You're already out of control,
Yeah,
right? And now, like, everything is out of your control and
exactly.
everything is gone, right?
Yeah. And one of the things is that, yeah, if they then come in there and they have an episode, like, they start acting up, become aggressive, then what the hospitals might do is like restrain them to the bed, right?
Right.
And just sedate them. But then once they come up sedation again, they're back to where they are. So it becomes this cycle. So this was a problem in the hospital, and they're building this kind of pediatric wing of this emergency department. And they were looking at our experience lab, and we actually have this a NICU room there. And they saw this adaptive room, and they thought, hey, look, this might be a solution that could be adapted to our emergency department space, right? Because at that point, they were looking at these holding rooms, and they were arguing amongst themselves, hey, what kind of mural should we paint on the ceiling? Should be the underwater or the jungle scene? And the chief experience officer of this department of this hospital was just like, hey, no, we should do away with these kind of very more kind of legacy way of thinking, right?
Right.
Making a pediatric environment, it means murals, whereas pediatric, the definition of it is like from 0 to 17. So you imagine a teenager, 15, 16, they don't want to do these kinds of more kind of
No.
infant,
Babyish.
yeah,
Right.
babyish, exactly,
Right.
babyish kind of decoration.
Right.
So basically, during the discussion, we thought, hey, look, some sort of adaptive environment would be maybe suitable for this kind of space, right? Of course, but we didn't know anything about really behavioral health. This topic is something we never kind of created a solution for. So I think the first thing we did is, hey, look, they invited us to their hospital down in Dallas, and we basically went there, and with the understanding that this is going to be a pilot exploration, we couldn't guarantee we're going to deliver any results at all, actually. And we just we wanted to help, right? Listening to their situation, the problem, say, all right, maybe we can do something. Let's explore this together.
Right.
So we ended up, spending a few days myself together with a design team to tour the emergency department and to basically understand the issues, right? So there's the same kind of shadowing, talking to the staff members, and we were actually lucky enough that one of the ex-patient was willing to volunteer himself to speak with us, actually, and that provided us with lots of insights, because usually that's more kind of behavioral health is more of a taboo subject. People don't want to talk about this,
Right.
but this particular young man was very brave,
Right.
and to be able to open up and gave us his inputs and gave us how he felt, actually, and what got him into that situation. So that provided us with a lot of insights.
Right. Was there any particular part of his interviews? What big takeaway did you come away with from those discussions?
Yeah, I think one of the big takeaways is that when he came to these kind of rooms, was that he just felt the loss of control and the loss of the things that kind of comforted him, right?
Right.
So immediately was, of course, like the mobile devices and things like this. And it's more than just more mobile device, right? So social media, but entertainment and things like this. So music was, things that he missed.
Music, big, yeah.
Yeah, and also exercise. He said, yeah, no, I'm locked in this room and I just, couldn't do anything. I wish there's a way for me to be able to work out, at least express myself, get my, something to do, actually.
Or even just get my frustrations out, right?
Yeah, exactly.
We talk about, like, especially when you're talking about, like, even like trauma or whatever, or your brain is kind of screaming. We all do it, right? People say,
Yeah.
take a walk around the block
Yeah.
or start punching something or what,
Yeah.
right?
Exactly.
Exactly.
So yeah, so that was, I think, one of the insights to see, that yeah, he wanted just almost to be normal, right? But of course, he knew that he was in,
Even though he's there.
even he's there, right? So to continue having access to these kind of things.
Right. Yeah.
So yeah, I think that was really interesting part to be able to talk to him, and he definitely had good suggestions of things that we were kind of took into account in our design as well.
So with this young man, you said that there was a couple of big takeaways was music, and then there was also like the ability to exercise. What did you put in the design in terms of the space that you address some of those needs?
Yeah. So I think the main thing that I think we brought in was, let's say, the technology element to this space, right? So it's pretty much a simple room, standard kind of size that had to be safe for the children. And, usually it's just bare walls and fluorescent lighting, right? So we looked to change this whole design to bring in this adaptive environment. So using projections both on the ceiling and the walls and colored lighting to be able to just paint a different kind of flavor to the room. So, biophilia, as you say, we have nature projections. We actually worked on kind of more calming projections versus something that's a bit more energizing, because also in our research, we looked at the cohorts of behavioral health. It's not just one type, right? So there you have the kind of folks that are more on the autistic spectrum, and aggression and things like this was
Right.
part of that behavior.
Even hyper.
Yeah. You have folks that are more suicidal, so they're very depressed and they are in a kind of very down stage. And then you have a small percentage that were kind of had psychosis actually. So they're basically seeing things
They're saying
or
things.
hearing sounds. So you wanted them,
Right.
yeah. So you wanted to have a very low stimulus. So working together with the kind of, let's say, the psychiatrists and in the hospitals and the kind of behavioral health specialists, we kind of mapped out different archetypes of patients, and that helped us, decide that, hey, with this adaptive environment, how can we change and adapt the environment to basically address the different age groups, the different kind of types of conditions, right? So that was definitely one thing that we looked at.
Right.
Actually, one big part of our solution that we didn't have was basically a way of controlling this environment, right? So we had the technology of the projections, the making of the content, the lighting, and we actually managed to find a partner. This is a third-party company that's not Philips that created this touchscreen that was basically bulletproof, literally. And so it was, there's a huge touchscreen. They have different sizes, and they had games in there, and they actually developed it for also a behavioral health space, with a different kind of thinking about it. So we actually managed to connect our systems with theirs and use their touchscreen as a way to control our system. So that was one of the ways to then allow the children to have control of their space, right?
Right.
So now they have this, let's say, tool or a portal to be able to change the lighting to suit their needs. With this touchscreen, we could bring in, television or radio, music. So that was really a great thing. And we even brought in games actually. And funny enough, one of the games was whack-a-mole.
Oh yeah.
And you can basically punch the touchscreen to play this game.
That's perfect. Yeah.
So this kind of was one of the, let's say, elements that we partner with another company to deliver this solution. So it's not just one company doing it, but coming together.
Yeah, I want to just make sure that everybody kind of hears what you're saying here because it's so important. These particular age groups essentially have their own autonomy, right? They have their own agency over their own environment, which is just so huge, right?
Yeah.
I mean, yeah.
Yeah. Indeed, actually. And, so we also work with the hospitals in the sense of looking at how can you provide, give the children incentive, right? And say, hey, look, if you promise to take your medication or behave in a certain way, then we'll slowly give you privileges in terms of, all right, now you can have television, you can have radio, so slowly kind of using that as incentive to give them what they want. So working in partnership. We also actually found that the touchscreen was actually really useful as a tool for connecting the nurses and clinicians with the child. So basically, by either playing games, so a game of chess or whatever game, puzzles, memory game that they do,
Right.
this kind of having them both sit in front of the screen and participate and having a chat created this bond between the clinicians.
Right.
So it became this technology suddenly it's not replacing, but it's actually bringing people in together. And I think that's really also important, right?
Right.
Something that I strive to do is how technology, frequently technology just gets in the way and, it's like people just, gets focused in it, but how can it become a facilitator of really human relationships, actually? I think that's also something really important.
Well, human relationships, right? As opposed to, again, closing the door.
Yeah.
I mean, it's almost like they're then forgotten,
Yeah.
right? And then they don't know what's happening in this way. They can stay engaged
Yeah.
and everything like that. That's just terrific, Alex.
Yeah.
I just want to ask you one more question about that particular room. You
Mhm.
mentioned putting projections on the ceiling, not just on the wall. Was there a reason for the ceiling
Yeah.
projection as well?
So actually, it was more of a hypothesis that we started with this. So, it was a pilot room. So we went in there trying to at least have the coverage of looking at, hey, what are the possibilities, right? And we did a projection, and we knew that with projectors, you can kind of, turn it off and then it's not there at all. So we're not taking up the space. So we're building, let's say, the redundancies to be able to test out different hypotheses. And one of them was really to have the children, when they're lying in bed, to have some sort of visual cue of looking up at the ceiling, right? So they're not staring at this blank ceiling. And one of the content that we developed for this projection was a starry night sky, actually, to help the children relax.
Right.
And we worked with the psychologists to have this star that would gently pulsate to a certain rhythm, so that if you don't know it's there, you won't see it. But then the psychiatrist might tell a child, hey, look, see that star there, focus on that. pace your breathing to it,
Pace your breathing,
and then to help
right?
them
Yeah.
calm. Yeah.
Yeah.
So that was a way of, to help kind of wind down an agitated state, to help them calm themselves using the content of the projection.
Right.
And the other projection that we developed was more of a sunny forest. So it was really, trees. You're looking at the canopy of the trees.
The canopy of the trees. Yeah.
Yeah, the sunlight kind of filtering through. So again, something, very nice that reminded you're outdoors. And in that scene, there were actually butterflies that flew across the screen.
Oh.
And
Oh, that's lovely.
the coaching that the psychiatrists want to do is that, hey, they'll tell the child, "Hey, imagine all your bad thoughts and terrible thoughts. Imagine these are the butterflies and they're just flying away, floating away. So
Nice.
one at a time, just let go of it and let them fly away." So we were basically developing these kinds of content to help, with the therapy as well. So I think for the first time, we're trying to now bring in therapy into this space where traditionally, they really couldn't do, they didn't have the tools actually to really work with the children, right? They might have some usual coloring books and things like this, and for the kids, but that was basically it, right? So we're trying to bring in some of these technologies to help create this opportunity.
Yeah, and reduce their stress
Yeah,
and everything, like you said, all the stuff that might be running through their minds and
yeah.
everything like that. I don't think I need to see any papers after all of this. I know that what you're doing is making a difference. Well, as I tell our listeners all the time, as inclusive designers, we look at the biology, psychology, and sociology of spaces, and it really looks like you've really tackled all three quite well. So, just to remind our listeners, we will have all this information on our website, inclusivedesigners.com.
Yeah.
Yeah. And is there anything else you wanted to add? Was there any last takeaways? And what's the follow up?
So maybe I think I would like to end that, at least for this behavioral health room, we're piloting it. And for now, it's starting to show very good results, actually. And I think some of the takeaways that, we created this as a pilot is that there's definitely some unintended uses that, we kind of discovered during the journey. So there was one anecdote that actually the nurse told us about this child that came into this department. She was basically really aggressive and out of control. She was like basically, breaking equipment, tearing wallpaper off the walls. And they decided, hey, look, let's try and put that child in this Phillips room. So they brought her over there with restraints, and she went to the room, and immediately what she did was she turned on the red lights. She just set the room to this really intense bright red, and the staff members were really concerned, like, wow, this red light, is it going to aggravate her more? And really, so everyone was like really concerned, should we just go and intervene? But one of the head nurses said, no, just leave it alone. And within an hour, she had really calmed down and de-escalated. They could take off her restraints, and then I think within the next half day, they could discharge her. And she was already, there for a couple of days, being really troublesome. So it goes to show that, because the red light, I remember, was one of the things that we should we just, block that from happening, because that's really intense, right? But I'm glad we didn't, because I think children, our kind of cohorts find a way of expressing themselves, right?
Right.
And this is something, again, we're still learning, discovering there's so many different possibilities. And who am I to say that red is not the right color, right? And that's, I think, one of the lessons for me as well. Yeah, there are different ways of expressing.
Yeah, but teenagers always have a different way of looking at things anyways,
Yeah,
I might have liked a red light too,
yeah,
right? And
yeah,
and again, I think it was in part that she was able to get that agency for herself, right? She was able to have that control
yeah,
and be like, yeah, I'm going to have the red light and just not allow anybody to say otherwise. With just even with that was probably what helped her to kind of calm down.
yeah,
All right, so just kind of switching gears a little bit, let's talk about in the innovation lab.
yeah.
I mean, all this work that you're doing is just amazing. What do we got coming up? What should we know about as inclusive designers? What do we have?
All right. So yeah, we have an innovation lab, here in Cambridge, Massachusetts. So this is Philips' headquarters here, and this is basically a lab where, yeah, we bring together a lot of our different advanced research, right? And we're trying to bring it into this lab, and it's kind of probing the future of what healthcare could be, right? So we're thinking about the tomorrow, thinking about what is the ICU of tomorrow, what is the cath lab, interventional lab of tomorrow. So we're trying to basically bring together these different thinking and groups of designers to build these possible or preferable futures, and we share that with our customers, the clinicians, and get feedback. So it's a kind of basically, yeah, I would say experimentation lab where we bring in technology and we try to build it in a very tangible way. and invite folks to come and experience it and provide us feedback. And this is how we kind of learn and grow and develop these ideas actually. So yeah.
Yeah. Well, I think you guys are doing some amazing work. And Alex, you also do some amazing work as a sideline. You want to tell our audience a little bit about it? And again, we'll have all this information on our website.
All right. Yeah, thanks. Yeah. So of course, yeah, working in the healthcare, is a very kind of serious field, very life and death. And in my kind of, let's say, spare time, I do something, other things that are more lighthearted, but still in the design area. So this something I've done is actually a plush toy night light. Actually, so it's a completely soft plush toy that also doubles as a night light. Actually, so this is something actually I created when my son was born. So that was basically about 15 years ago for my wife actually, and I for us to do the kind of nighttime nursing feeding. So it gives off a very gentle light, so we could basically do our nighttime chores without waking up the other partner. And then when he kind of grew a bit older in a toddler, it became his kind of companion to comfort him at night, so he could sleep by himself and have his own personal light that he could control actually. So if you, yeah, the characters that you click its belly button and it glows and then it turns off by himself. 15 years later, we decided to do a Kickstarter kind of a campaign, and it was successful. So now we've produced it, and I've got a little side business, at least just selling it.
A little side business. I
Yeah,
know. It's called Lumi, right?
that's right.
Lumi.
Yeah, Lumi. Yes.
What was behind the name? Is that like a children's book name that I'm not aware of? Is there?
I guess it's because it glows. It's yeah, illumination, Lumi, and it does actually come with a storybook as well.
It comes with a storybook. I didn't know that. Really?
Yeah, the life of how Lumi came to become Lumi, and why does he Lumi glow?
Oh.
Yeah.
Oh, I love that. Well, I can see what I'm getting from now. That's what I'm gonna go give a lot of my friends. Is there before as we're kind of wrapping this up, our conversation today,
Mhm.
Alex, it seems like you've kind of conquered the inclusive environment quite well. Is there anything you want our listeners to know? Like, is there any last parting words? What do you see the future maybe? Or what would you say to yourself if you were a younger designer? Like, kind of riff with me a little bit.
All right. Yeah, I wouldn't say, I've conquered the inclusive design. I think I'm on a journey. There's always a lot more to
Well,
learn.
I know a lot about this stuff. I'll just let you know right now, Alex, and you check a lot of boxes as far as I'm concerned. Just so you know.
Thank you.
And you've written a children's book, so like that's pretty cool, right?
Yeah. I think, it's just, having this kind of naivety, I guess, to come into a space, that you don't know, to be able to open yourself to learn about it, right? And, I always say, yeah, it's not having the arrogance to say, hey, I know everything and this is the way it should be, so really talking to the folks that you're working with. And I think also my definition of inclusiveness is also looking at the casting a wider net, right? So just like the NICU, the parents were not someone that people focus on, but they were actually equally as important, right? So in any situation, any solution you're designing, not just look at the immediate user, but who are the other supporting
The sporting,
stakeholders.
yeah,
Yeah,
right,
even it could be the parents, it could be at least in the healthcare, that some of the decision makers that might buy the equipment, all that. So all these people
right,
working together in this ecosystem, I think is one of the things that I think we're starting to look at more. And also, I think, at least in my field in the healthcare area, it's so complex that not one company can own everything. So we're starting to look at partnerships with different ecosystems where one company like Philips might deliver one aspect of the solution and partner with someone else, maybe even a competitor to deliver something else, right? So, but together, at the end of the day, we're delivering a great solution that works together for the benefit of all the end
right,
users, right? So
right.
I think that's a key thing, and that's where I guess it's the change from when I started my career many years ago. Is that it's more all right, yeah, you only have this company. We need to own all the space. We need to own everything, and it's that singular user. But now I think there's a lot more actually that we need to look at as a system.
Right. Yeah. I mean, I think that's an interesting journey that you just referenced, that you've gone from this singular look to like really, I mean, I dare say it, an inclusive approach to, healthcare.
Yeah,
So I think that's really quite lovely.
yeah. Yeah, and I think that also maybe I'll make just another quick point. I think that also goes for the design team actually. I think one thing that I've discovered is that there's so many, design is becoming so complex as well. So for instance, design the NICU room and all that. It's not just, hey, look, I'm a industrial designer, or I'm a user interface designer, or I'm a video specialist. We're bringing all these folks together from architects, right, from all the different disciplines working together as well. And I think that's also on that side including all the different viewpoints in the creating of the solution. And it's not just, look, it's the product marketing guy that's making that, let's say, specification, but it's everyone coming together and working more in collaboration.
Yeah, no, I mean, it's really quite terrific. I mean, because this is the discussion of not doing these things in a vacuum, right? Like, and it's about really kind of the collaboration only brings great minds together, which only helps the better good,
Exactly. Yeah,
right?
indeed.
Yeah, no, I mean
Yeah.
it's just perfect, Alex, and I thank you so much for stopping by. And we're gonna have all this information for our listeners on Inclusive Designers Podcast website, which is inclusivedesigners.com. And Alex, thank you again so much for being here and sharing your wisdom with our listeners. And if there's anything else you want to, I know we just went over this, but if there's anything else you would like to express, please let our listeners know.
No, yeah, thank you for inviting me to this show. Actually, it was a pleasure talking to both of you and sharing my experience. So I thank you very much.
Alex is so impressive. He's one of those inclusive designers that is thinking of everything in these highly technical environments for some very vulnerable populations. These pilot adaptive environments are amazing in the way they seek to make the experience better for patients, families, and clinicians. Using meaningful, human-centered innovations, they are truly reimagining the ER experience for both the NICU rooms and pediatric behavioral health.
In the NICU, I really like how they're using the software and screens to help the parents be more informed and involved in the baby's care. And for those parents to be able to more easily navigate the information they need is so important.
Yeah, I also found it fascinating that they were then able to take that knowledge and tools from the pilot NICU space to create an alternative for the sterile rooms usually used for pediatric behavioral patients. This work with behavioral health should be inspiring for designers no matter what their area of interest. They included interactive ambient elements like the tunable lights, calming sounds, and immersive projections. These seem to calm agitated pediatric patients, which we know will lessen the need for sedation and potentially de-escalate patients who might be unregulated. Not only did it give the patients a sense of comfort and control, the projections could even be used by staff for additional therapeutic treatments. It is interesting to note that this was already in the works before the pandemic. Making a room that allows for some agency when they have no agency in their lives, in this case a juvenile who is in crisis mode, can really help to relax and calm the mind.
I know. I think they should consider creating a home version. Who wouldn't like to use that pulsing star to regulate their breathing, or let a butterfly take the day's stress away?
Well, you may want one at home, but there are so many other places that could use a calming zone like this too. When we think about trauma-informed design, for example, these could be great tools to put into the workplace or schools.
And that is why you are the professional.
Well, and speaking of professional, one last point that keeps coming up in all our discussions in our field is the importance of co-design. We need to look beyond ourselves and collaborate to reveal the best design decisions.
And stay tuned. We may even have more on this topic in our next episodes, which are already in the works. And we can't go without giving a quick glowing shout out to Alex for creating his plush buddy Lumi.
Yeah, gotta love Looming.
I admit, I've already given one to my niece Allison and her little one, Jordan.
And we will share the link for how to contact Alex. And of course, the links to the innovative work that he and his team at Philips are doing, and also for the many other things that were mentioned along the way during this discussion, all on our website at inclusivedesigners.com.
That's inclusivedesigners.com.
A big thank you to Alex Tan, and thank you all as well for listening.
Along with all the regular places you get your podcast, you can also find us on YouTube as, you guessed it again, Inclusive Designers Podcast. And of course, if you like what you hear, feel free to go to our website and hit that Patreon button or the link to our GoFundMe page. And now you can also find us on FeedSpot's list of best design podcasts.
Yes, you can. And as our motto says, stay well and stay well informed. As always, thank you for stopping by, and we'll see you next time.
Yes, see you next time.